with all of the conflicting information I see out there every day, it's confusing me. And I'm just not sure I want to follow through with it.
Yes, this has been a pandemic of misinformation, and it is definitely very confusing. I'll tell you, a lot of people that I've seen in the hospital when they have not been vaccinated, it's not because they're anti-vax or they don't, they just didn't know, and they were confused and they were scared. And it's heartbreaking because there is a lot of misinformation out there. I think a good rule of thumb is to probably avoid social media outlets for medical information, and really to rely on, healthcare professionals, your doctor. And if someone doesn't have a primary care doctor, it'd be a good time to get established. But also there are some websites out there that are verifiable. The CDC has really great information. UTMB, we have a COVID webpage where we have information. A lot of academic institutions are going to have their own COVID information. But really, at the end of the day, I would avoid Facebook and name your, social media, and really talk to a healthcare professional.
Yeah, I'm going to let Dr. Kaiser have the last word, but I'll just say very briefly, I agree with everything Dr. Berman said. It is hard for people we have had an explosion in the amount of available information in the last couple of decades. It used to be that people could just kind of rely on a couple of trusted sources. You turned on the television, it was Walter Cronkite. That's where you got your knowledge from, right? Like, there was a time where the information was very scarce. And as we've gotten much more technology, internet has grown, we have just endless amounts of information. And it is really hard to sift through what it all means, especially when it's a new pathogen in a new population spreading in ways that we still are trying to understand, right? I mean, we were changing information. That's what happens in science, right? We get new information, we change, right? Just look at aspirin, okay? Aspirin is the best. Now aspirin, not so great. Aspirin's the best. And though it's only in these certain populations, we get new information, we have to change. That's what we do in science. That's what we do in medicine. We evolve, we change. And that's what we have to do, is we have to metabolize that and help our patients understand, right? That's hopefully what you trust us to do. That's why we go to school. That's why we do all this training, is so we can try to distill this information into something that's going to help you live the healthiest life possible. Your public health experts the same way. Problem is that as information has gone out there, it's made it very difficult for people to make those decisions. So we hope that, like Dr. Berman said, you'll go to trusted sources and certainly ask your local health authority. They are really wonderful sources. So with that, I'm going to hand it over to Dr. Kaiser.
Yeah, all I've got to say is this: is as soon as the Ukraine war started, there was a meme on Facebook showing Forrest Gump that said, "And just like that, everyone on Facebook stopped being infectious disease experts and became international relation experts." So there you go.
Very good. Well, great. Well, hey, I want to thank you all for joining today. I can speak from experience that this is going to be a real asset for us with the work that we're doing. And I think it'll be great for any user who wants to view it. But before I close, I wanted to see if there was anything else that you all wanted to tell the audience.
Get vaccinated.
Get vaccinated. Okay.
Yeah, I boost that remark.
There you go.
All right. Well, thank you again, and you all have a blessed afternoon.